Hi, my name is Chloe Hiles. I'm a student PT from Penn State Hazleton. Is that right for local today?
Yes.
Can I have your name and date of birth?
Elena Welsh, 7:30 above 3.
Do you know where you're at today?
Penn State Hazleton.
And do you know what day of the week it is?
Thursday.
Yes, it is Thursday. So today what we're going to do is we're going to do something called TENS. I understand that you've been having some pain kind of up in this region on your right shoulder, which I'll ask to see like later just to check your skin in that area, make sure that everything's good. So what we're going to be doing this for is to bring your pain down. It's kind of like an electrical current where you shouldn't feel any sort of like zapping or prodding. It's going to feel like smooth and comfortable. It's kind of going to feel like fluffy, I guess you could say. It's going to bring your pain down. It works with like a control theory, which basically is just going to add sort of another stimulus in that area so it decreases your pain.
Okay.
On a scale of 0 to 10, 0 being no pain, 10 being the worst pain that you've ever experienced, what pain are you in today?
Like a 9 out of 10.
Okay.
Yeah, it really hurts.
Yeah, I'm sorry to hear that. So hopefully we can get that fixed. So now I just have a couple questions for you.
Okay.
Do you have a pacemaker?
No.
Were you told by your doctor at all not to move your arm or your neck, like independently, like by yourself, just moving it actively? Do you have active bleeding?
I don't think so.
Do you have cancer?
Nope.
My patient is not disoriented. Are you pregnant? I won't be doing it over superficial metal implants. I'm going to be checking if her skin is anesthetized, which it won't be. Do you have any open wounds in the area? I'll be checking for those.
No, not that I'm aware of.
I'll be checking for extreme edema. I will not be doing this over her eyeballs or her neck or her carotid sinus. She's not going to be using any heavy equipment in the clinic. I'm not going to be putting this anywhere inside of you. It's going to be all external. I'm going to keep it out of reach of children. Skin irritation may occur at site of electrodes,
Okay.
which is normal. That's a normal response.
Okay.
And I will not be doing it on a patient with known myocardial disease or arrhythmias without proper monitoring or safety precautions.
Alright.
So now that we got all of those out of the way, I'm just going to look at your skin really quickly, and I'm just going to do a little bit of palpation. So I'm just going to have you lay down on your stomach.
Okay.
You can get a pillow just to get comfortable.
My head down here.
I'm going to have you move your hair for me. Is that comfortable?
Yeah.
Okay. I'm actually going to get on the side. Okay, so I'm going to inspect her skin. Her right shoulder looks good. Her neck looks good. Can you move your hair just like a little bit more out of the way for me? Okay, and now I'm just going to be looking at the area. I'm going to be palpating. So this is going to be light, and this is going to be deep.
Okay.
So you're just going to let me know what sensation you're feeling in the area. I'm also going to be palpating for pain first. So does it hurt here?
Yeah.
Does it hurt here?
Yeah.
Here?
Yeah.
Here?
Mhm.
Here?
Mhm.
Here? Okay. So now I'm going to be doing the light deep that I just showed you earlier in the same areas. So just let me know whichever one you're feeling.
Okay. Light. Deep. Light.
Mm-hmm.
Deep. Light.
Okay. So your sensation is all intact, which is a good thing. So now I'm just going to have you move your neck for me, just so I can get a general seeing of how your neck is. Yeah. Just bring in a circle for me. And just move your shoulder for me. Okay, good. Your active range of motion looks good.
Okay.
So what were you doing before this?
I worked at a coffee shop.
Okay.
Yeah, I was the owner.
Oh wow, okay. So would you like to get back to that?
Yeah, you know, it's just a very demanding business.
I would assume so.
It's a lot of work, so I gotta get back to it.
Is there anything else that you're struggling with, like driving, just turning your neck in general? Reaching high shelves maybe?
It does hurt when I like sit for so long.
Okay. Alright, so hopefully we can bring that pain down. So, what I'm going to be doing is be cleaning the skin. I'm going to be preparing her for TENS since she is successfully able to do it all. She doesn't have any of the 16 contraindications. Once I get this box open. Mm-hmm. Just going to be putting the battery inside. Can you pause the video? Okay, welcome back. As you can see, the patient's and I have the correct machine. So now, without any further ado, what I'm gonna do is I'm gonna put these pads on you. Don't ask how they have your name on them already. I knew you were coming. So I'm just gonna put these pads on you, and you're going to feel sort of comfortable pins and needles feeling. If it feels painful, let me know. I'll turn the machine down. In the clinic, we're going to do it for about 15 to 20 minutes, and I'm going to have her set up on conventional mode.
Yeah. You did it. No, it's good. Yeah, this is right.
That's okay.
Okay, so I think that just happened.
Honestly, yeah. One of these pictures was
I put this was right on like the edge.
So I'm going to set it up for that.
the only one I was like really into.
Are you guys partners? No.
Okay. So first I'm going to use an alcohol wipe on her skin to get rid of any sort of oils or anything else. Or lotions or anything in that area. So I'm just gonna alcohol her down. Okay. That's good. And now I understand that you've been having trouble in the C3, C4 area, so I'm just going to be putting her electrodes like right up here. Sorry, I'm just gonna move your hair. Sorry if you're ticklish. A little bit. Sorry, this is probably cold. Okay. These might be cold. Making sure that it don't get stuck to her hair at all. I just did. Then I'm going to be putting the other set on her right dermatome where she's feeling that pain. So could you point to the pain sort of in your area right here? It's sort of like right here?
Yeah.
This area. Okay. So before I turn the machine on, I'm just going to obviously be double checking to make sure that all of the pads are down so that we don't have any hot spots in the areas. And I'm going to be asking you while I turn the machine up, just let me know when it's too high. You just need to plug your electrodes in and you'll be ready to go. Okay. Now at the clinic, we'll usually be doing this for 15 to 20 minutes. I'm going to setting up this channel right here.
The doors. Gotcha.
Checking that the pads are all down. So I'm going to be turning up the ones on your neck first.
Okay.
It should be just comfortable. You shouldn't be feeling any pain. Okay. So I'm just going to be turning it up slowly, and you let me know when you start feeling it. Is that good, or would you like a little bit more?
I don't feel it.
Okay.
Oh, I feel it.
Is that good?
Yeah.
Is it comfortable? Okay. So I'm just going to be double checking the pads on her shoulder just to make sure everything is down. Okay. Now I'm going to be turning up the pads on your shoulder to let me know when you start feeling it.
Okay, that's good.
That's good? Okay. So now I would have her set up for 15 to 20 minutes when I am in the clinic. And I'd be asking her how she is feeling. Halfway through. How are you feeling?
Good.
It's halfway through. Okay, now the treatment is complete. So I would turn down the electrodes. Okay. And how is your pain now?
A 5.
Okay, good. I'm just going to be removing her electrodes. And I'm just going to be rechecking the area, checking the palpation. Going to be checking her skin, making sure she's not having any abnormal reactions to the electrodes, and her skin is intact. So I'm just going to have you do that motion for me one more time with your neck. Just move it all around. Okay, good. And I'm just going to have you move your right shoulder just all around. Okay, and how are you feeling? Good. Good. Okay. And that will be all that I have for you today. Do you have any questions for me?
No.
I'm also going to do a quick sensation check right here. It's going to be like deep from before. This is leg. This is deep. Okay.
Light. Light. Deep. Light. Deep. Light. Deep.
Okay, good. Do you have any questions for me?
No.
Okay. That's all I have for you today. When you are at home. So, I understand that you don't have one of those at home, so what I'm going to
I do
do
not.
is I'm just going to have you, if you have an ice pack, or anything that you could freeze, just put 5 to 6 layers around the ice pack, put it on your skin where you're feeling the pain for 15 to 20 minutes. But before you do that, you're going to want to do some light stretching in that area. If you feel an increased pain or increase in symptoms, please stop doing stretching, just ice it, and don't ice it more than 15 to 20 minutes.
Okay.
Do you have any questions for me? Okay, have a good day. That's all I
Thank
have.
you. You too.